Hi, everybody. Gwendolyn Borg, president of Focus for Community Unity and support the Lancaster Due to Pew Addiction Prevention Coalition. Right now, I have Officer Stacy Maute. She is the school resource officer with the Lancaster School District. Stacy, how are you?
I'm good. How are you?
Just real briefly, can you explain your role with the Lancaster schools and maybe some of the things that you've seen throughout the past couple of years as well as this year?
Sure. Officer Stacy Maute. I am a police officer with the town of Lancaster, and I am also the school resource officer with Lancaster High School. I follow up on anything that happens within the schools as far as any criminal activity, any mental health issues. I also follow up on anything that happens with high school age kids outside of school, domestic incidences. We advise students on numerous topics. We try to get into the classrooms and instruct and teach them about different things as far as cyberbullying, social media issues, mental health issues, drug issues. This year has been a little bit different because we're not necessarily able to get in the classrooms as much as we like, but we have various roles here at the school.
Okay, so let's stop right there. As far as, over the past 2 years, we know last year was even a little different because the kids stopped, mid season and they were in school the full year the year before. What have you seen as just far as like drug related incidences going from the 18-19 school year to the 19-20 school year as well as this year?
So I went back and looked at some of our drug incidences. So in 2018-2019 school year, which was a full school year, we had 12 cases of possession or sale of drugs within school. So that was 12 within 2018 and 2019. Now last year, the 2019-2020 school year, which only went from September to March, we had 12. So you could see that we were on par to have probably double of what they had in the 2018-2019 year. So far this year, we haven't had any. That does not mean it's not happening. It just means that there's less students here at school. There's less access to the bathrooms. There's different ways now that you have to sign in to go to the bathroom. There's also, not as many times that people can meet and get together. So just things have been a lot more stricter as far as what students are able to do because of COVID.
So
because of the pandemic.
Yeah, exactly. Right. So what have you been focusing on so far this year in a extremely just totally awkward, education type of system for these kids now these days?
So we still are trying to educate kids as best as we can. The younger SRO or the elementary school SROs is still trying to get into classrooms and instruct the little kids on lockdowns, very important things that we still need to worry about building safety. Because even though we're in a pandemic, building safety still is, a cause of concern all the time. So we're still trying to do that. But we also have been dealing a ton with mental health issues, welfare checks. At the high school age alone this year, from actually just in the month of November, we had 14 attempted suicides. That's not just threats of suicides, that's actual attempted suicides. There's been many more threats of suicide. So our jobs right now, at least mine at the high school level, has really moved towards having a collaboration with the social workers and the school psychologists, guidance counselors, and trying to figure out plans moving forward to try to help these kids when it comes to their mental health issues.
Yeah, that's fantastic. I don't think a lot of people, parents really realize until maybe something's either too late or they're in the midst of the crisis, like the resources that, as a school resource officer, you can provide and uniting a team together,
Yeah. So, I think as far as drug use goes, it's still happening. It's just happening outside of school. Okay. Maybe it's still happening in school, but I think mostly outside of school because of the limited access to the school. We have tons of resources when it comes to the drugs and vaping also. But when it comes to mental health, it seems to be escalating a lot. And I think a lot of it is because we've taken everything away from kids, right? They don't have sports, they don't have their friends, they don't have school. A lot of times for some kids, school is the only outlet that they have. It's the only safe place sometimes. And there's a ton of resources at schools. I myself did not know there was this many resources until I became a school resource officer. But there's social workers here who work with students on, a weekly, monthly basis. And so what we're trying to do is we're trying to create like an outreach program where the social workers, the school psychologists, we all touch base and with guidance counselors, teachers, to see who the most at-risk kids are. Sometimes a student will talk to a teacher more than they'll talk to their parents, and will express to a teacher like how stressed out they are. Or sometimes, they'll reach out to their guidance counselor and talk to them about how, stressed out they are. Those cases we'll look into, and then we'll try to go out to students' houses and do more of a face-to-face instead of just over a Zoom. We won't go in the house, but we'll be outside with the student and talk to them. And a social worker can even separate from me and have, a one-on-one conversation with this person, just so we can physically see that they're okay. Lots of times you can be anyone behind this computer screen, right? I mean, and you can look okay, but when it, or you're in the house, and sometimes you're in the house with people who are stressing you out, and you can't disclose what's actually happening. So we want to make sure that we at least check on the most high risk students that we have, or anybody that contacts us with any type of concern for somebody. We want to make sure we actually do the face-to-face with them.
I think that's fantastic. I think we've all witnessed it, even on a parental and an adult level, the value of that face-to-face type of interaction, and being able to look at somebody and see them, and not behind a screen. You're right. So I just commend you and everything that Lancaster schools are doing to stay connected with their kids, to, hopefully help them, get through one of the hardest times, probably in their entire lives, as we all will know it. So thank you for your help. Thank you for just working so hard. And we'll make sure that we have, your contact information and all the school's information, at the end of this program. Thank you, Officer Stacy.
Thank you very much. I appreciate it.